Spring break starts tonight for students at Western Carolina University. And many tell us that coronavirus is on their minds as they head to their spring break destinations. News
13's Rex Hodge is live in Cullowhee. And Rex, they say the outbreak is a factor in their planning.
Yes, I spoke with several students today who told me they are going to Florida. Coronavirus very much on their minds, but they say it's not going to stop them. A cold early March day on the Western Carolina University campus, a reminder that winter is still here and a flurry of activity as students start leaving for spring break.
We're going to Panama City in Florida.
Sophomores Caitlin Sharp and Alyssa Bignall about to make the drive, aware of coronavirus.
You think about it, especially when it's happening more often.
They still plan to make the trip.
We're pretty young, and I've looked at the recovery rates and stuff, and most people are fine.
They'll follow common sense guidelines like washing hands often.
We're flying from Asheville tomorrow morning.
Drew Jones and his family traveling to Tampa St. Pete.
We did consider actually not going. We decided that the risk isn't high enough. We're going to take precautions and stuff like that. We've been stocking up on wipes and all of the hand sanitizer.
We're going to head to Orlando and go to the Kennedy Space Center and Universal Studios. I think it'll be fine because there's so many people traveling and stuff, and they've more or less got people quarantined. They're trying to keep it contained. But from what I hear in the news, it's kind of 2% mortality rate. So even if you catch it, I'm not really worried about dying from it or anything.
Freshmen Stephen Ryder and Leah Vargas not canceling their plans either.
It's not fun being sick, but I don't really think I'll get it.
Okay.
The interim president of the UNC system on Western's campus Thursday, highlighting needs at the university's steam plant and for NC Promise funding. Bill Roper spoke out on coronavirus as well, saying the system just convened a senior-level advisory group of chancellors.
As the number of cases rise across the country, some experts say not seeing a doctor face-to-face might be a better option. Let's go live to News 13's John Lee in Asheville. And John, Mission Health tells us using a smartphone or computer can weed out folks who don't need to go to the ER.
And Darcel, we're right in front of the Mission Walk-In Clinic on Long Shoals Road. Yet one doctor here says many patients shouldn't walk in, that virtual care is actually a better option for many of them. As concerns about the COVID-19 virus continue,
North Carolina has identified a second presumptive positive case.
Experts believe it's important that patients with less serious illnesses see a doctor in less traditional ways.
And you can do that from your own home as opposed to going to a clinic or going to an emergency room and being exposed to potential illnesses.
Each year, about 5,000 people turn to Mission Health's virtual clinic. Patients launch an online account, log in, and fill out a 5 to 10 minute questionnaire to find out what their health issue is.
In the past 14 days before the start of your symptoms, have you traveled internationally? So it will ask a series of questions to make sure you're an appropriate candidate for virtual care. And then if you are, it will send the message to the doctor.
From there, doctors like Carl Spears determine how the patient should proceed.
For one thing, it can be a source of good information about whether you need to be tested or if your symptoms warrant further evaluation. Please list the countries where you've traveled.
The virtual clinic provides care for a variety of medical issues, and especially while the coronavirus outbreak is top of mind, Mission says it's an important resource.
They're better off staying at home and not exposing others.
Buncombe County's detention center is undergoing some major procedure changes when it comes to inmates and drugs. News 13's Caitlin Penner spoke with Buncombe County Sheriff about the jail's new treatment program and got a sneak peek at the new way the jail's screening for drugs.
In 2018, there were 88 opioid-related deaths here in Buncombe County. 46 of those were former inmates at the Buncombe County Detention Facility. Buncombe County Sheriff Quentin Miller says he's changing the way things have been done so that number can drop.
I know I'll probably be criticized. Again, for me, it's about saving people's lives.
Buncombe County's jail is now a part of the 1% of jails across the country using medication-assisted treatment to help inmates get off drugs.
Today we started with our overdose kits. So everyone who's identifying opioid use will receive an overdose kit which will protect them.
Along with giving naloxone kits to people leaving the jail, people coming into the jail already on medications like methadone used to treat drug addiction are allowed to continue using them while in jail.
We're going to attempt to do something. We're not going to stand by and continue to do what we've done in the past and then allow people to continue to die.
The jail is also getting ready to make all incoming inmates go through this new body scanner. Using the same technology TSA uses, deputies will now be able to screen for things like drugs.
So treating and addressing the addiction at the core is a huge culture shift, and that's impacting law enforcement. It's also impacting secure facilities such as detentions and jails.
Sheriff Miller says around a third of Buncombe County inmates suffer from drug abuse or mental illness. Studies show that people released from jail in North Carolina are 40 times more likely to overdose on opioids.
Every time someone basically ODs and the Buncombe County Sheriff's Office respond, I get a text, right? And so I have to look at this most of the time daily, sometimes twice a day, where someone is OD'd.